Welcome everybody to our April meeting. Once again, I'm going to introduce Ms. Maddie Verna, who is a fabulous nurse at MedStar Washington Hospital Center, all in cardiac telemetry, cardiac ICU. And once again, we're getting the benefit of her working on her master's at Penn State in nursing education by educating us today on heart failure. Maddie, thanks for being here and take it away.
Thank you so much. So today we're going to talk a little bit about heart failure. A couple things just to kind of give you guys a roadmap for things that I want to talk about, and then there'll be time for questions at the end, is we're going to review the causes and types of heart failure. We're going to talk about heart failure symptoms, which I know if you were here for last month's meeting, you probably got a little bit of that already, but we are going to talk about it once more. And then we are also going to discuss heart failure treatment and self-care. This is kind of the bulk of what it is, just in terms of what you can do to help support the treatment that has been laid out by your physician. And then also discussing when to call your doctor or seek medical attention for heart failure symptoms. And that's also something we talked a little bit about last month, but when talking about heart failure, it's good to just know when to recognize signs and symptoms that you may need to contact your doctor or medical professional. So I wanted to talk a little bit about that again this month. So first things first, we're going to talk a little bit about the basics. This slide might be familiar from last month for those of you, but I just wanted to talk a little bit about what heart failure is. So it occurs when the heart can't pump blood as well as it should, and that's either for one of two reasons. So heart failure with reduced ejection fraction, which is shown in the picture on the right-hand side, is when the heart is too weak. So the heart's having trouble squeezing for whatever reason, so it can't squeeze out the appropriate amount of blood that it's supposed to with every heartbeat, which reduces the output of the heart, which in medicine we call the cardiac output, or just the amount of blood that's pushed out by the heart. The other type of heart failure is called heart failure with preserved ejection fraction, and that's when the heart is too stiff. That is referring to the diagram that you guys are seeing on the left, having to do with the heart not being able to fill. So either the bottom two chambers of the heart, which are called ventricles, are stiffened, or they're thickened for whatever reason, and maybe the heart can pump out an adequate amount of blood, but it can't fill with it. So the amount of blood being pushed forward is still too low. There was a question last month that I think Brian had asked about whether men or women were more likely to get heart failure, and I did look into it. It just has taken me a while to get back to you, but heart failure, actually, the overall lifetime risk for men and women developing heart failure is equal. But women are more likely to have the heart failure with preserved ejection fraction or the stiffened heart muscle than men are. Men are more likely to be diagnosed with the reduced ejection fraction. But overall, if you look at the numbers, it's pretty much the same. Overall, there are currently almost 7 million people in America who are living with heart failure. So this condition is experienced by a lot of people, and it can have a lot of different causes. So chronic high blood pressure can cause the workload of the heart to be too much. So the heart eventually can weaken because of that. Another cause of it is coronary artery disease. So from heart attacks, there might be some weakening of the heart muscle after the heart attack has occurred that causes the heart to weaken. Another type of cause is called cardiomyopathy. And cardiomyopathy is a whole host of conditions, a lot of them having genetic or autoimmune causes that can affect people even if they don't have heart disease otherwise. We see this in a lot of people who, if you know that you have like a family history of people having heart disease at a very young age, and having especially heart failure at a very young age, it is likely that it is part of this group of things called cardiomyopathies. And then additionally, heart valve disease is another common cause of it because when the valves are too stiff or too floppy, they can cause blood to back up and not move forward as it should, which puts increased pressure and stress on those ventricles in the heart and can cause them to eventually experience failure because they have to do so much more work than they should be doing. So those are kind of the basics of what heart failure is in terms of what's happening in the body. We'll talk next a little bit about typical heart failure symptoms. So typically people may experience shortness of breath, and not necessarily just shortness of breath. It's shortness of breath that requires you to cut back on your activities. So If you're used to going on a 1-mile walk and all of a sudden it's difficult for you to walk just down your block, that would be shortness of breath that would be concerning, and also requiring you to sleep on several pillows to elevate your head. So especially this nighttime shortness of breath, if you're waking up feeling very short of breath, that can be a heart failure symptom, and using more pillows than usual. Feeling tired or very fatigued quickly, and that's because the heart, when it is not as strong as it should be, has difficulty pumping blood and compensating for the increase in activity. Additionally, weakness, particularly in your legs while exercising, dizziness or lightheadedness, a rapid heart rate even when resting. Normal heart rate typically for most people is between 60 and 100 beats per minute. So anything, if you notice when you're resting and you feel like your heart's kind of beating fast, if that number is higher than 100 beats per minute and you haven't just sat down from a walk, um, it's kind of all the time, then that would be considered to be a rapid heart rate. And then swelling in the lower legs and feet, which we call edema, or in the abdomen, which is called ascites. And then additionally, unintentional weight loss. So that fluid can cause a little bit of weight gain, like we talked about last month. But if you notice that you're losing weight without trying to, that may be something to bring to your doctor's attention, because that also can be a symptom that the body's not getting the blood flow that it needs in order to be able to use energy, so it's losing weight. So those are some typical heart failure symptoms. The next couple slides I want to talk about are really some things that I want to, whether you're living with heart failure or you know someone who is, that you can kind of be empowered to think about doing these things in your life to support the treatment plan, whether that is with medication or whatever else your doctor or provider may have you doing, that you can kind of do to help support yourself and maintain your health. So the first thing here we talk about is smoking. So nicotine, which is in cigarettes, increases both heart rate and blood pressure. We talked when we were talking about the general basics of heart failure about how when the heart is under more stress, that can cause increased workload and eventually lead to worsened heart failure for those who have it. So when nicotine's in the body, it can increase the heart rate and the pressure that the heart is pumping against, making that work actually harder. It also has been shown to lead to more blood clots in the vessels around the heart, and that can lead to a higher risk for heart attacks. People who do smoke have that. So people who stop smoking, though, are more likely to have their heart failure symptoms improve than those who continue smoking. So if this is something that you or someone you know is currently dealing with and you're interested in stopping smoking, I would definitely recommend to talk to your doctor and figure out what sort of things might work for you in starting this journey, because we know that it is a process. And yeah, it's definitely something, though, that could be worth it if you have heart failure. The next thing here is talking about maintaining or losing weight. And so especially in heart failure, we have to be careful to differentiate weight that's from fat tissue and weight that's from water weight. So it's very important in heart failure management to track your weight daily. So you want to do it at the same time in the morning, generally before you eat anything, so the food that you put in your belly isn't accounted for in it. And then after urinating or using the bathroom for the first time in the morning, so that that's not additionally added to it. Taking it at the same time consistently will help you kind of get a record and a gauge of what your weight normally is, so you can be better attuned to if there is a lot of change suddenly, because that is one symptom that your heart failure can be worsening. If now shifting to talk about more fat tissue, your heart works harder to pump blood if you are overweight. So you want to talk to your doctor, though, especially if you have heart failure, before starting any sort of weight loss regimen, because there are certain things that they may have to consider based on your condition of what sort of exercise that you could tolerate or what sort of diet changes should be good. So definitely before starting any sort of regimen, you do want to talk to a healthcare provider who can help you make a personalized plan that will work for you. Like I was talking about up at the top, sudden weight loss or gain can be a sign of worsening heart failure. So gain from water weight from more than 3 pounds in one day or about 5 pounds in a week would be concerning enough that you should contact your healthcare provider, and maybe they'll adjust your medication or just do like further asking you questions. But that's the thing that should be reported, because additionally, when you have more fluid in the body and the heart has more pressure from that fluid that it's pumping in the blood vessels, then it also is having to work harder as well. So making sure that you keep really good track of your weight, especially that water weight, is really important in heart failure, and doing it at a consistent time. You can even write it on a calendar. So if you have a calendar, that we can keep track from day to day and week to week, kind of how things are going. So you can notice if, you do have that 3 pounds in a day or 5 pound in a week change. You have it written down, you can see it. The next thing here is just talking about fluids. So you want to keep track of fluids, because your body can retain fluid in heart failure. That same swelling in the ankles and in the belly that we were talking about as heart failure symptoms on the first slide is basically just from your heart being stressed, and that fluid, instead of staying in your vessels, it goes into the space between the cells. So holding onto that fluid increases the stress that's on the heart though as well. Your doctor, depending on what they say, they may recommend limiting your intake of liquids. And then some people are also prescribed medications called diuretics or water pills to help them get rid of extra water and make the heart's work easier. But again, either a fluid restriction or medication to manage fluid would be driven by your provider, whether you're seeing whoever you're seeing in the heart failure clinic or doctor's office. So you wouldn't want to do either of those things unless they had recommended it for you. But it is important, if you have been recommended these things, to keep track of your fluids and keep track of what medication you're being given for them to help pull off the fluids if that is in fact what your provider's recommended. The next slide here just talks a little bit about alcohol and caffeine. Basically, the key here is that moderation is key. So alcohol, too much has been linked to heart problems such as high cholesterol, high blood pressure, heart rhythm problems, and heart failure. So the American Heart Association recommends about 2 drinks per day for men and 1 drink per day for women as like a moderate max. Because above that, they've shown that kind of these things can occur for people with heart problems. And then caffeine is a stimulant, so it's going to increase your heart rate and increase your blood pressure. So they recommend about 1 to 2 cups of coffee per day. And that's honestly not even just for people with heart failure. I think that's for everyone. Because we want to make sure that, we can have these things, they're fine, but just moderation is key, is the point. The next piece here is just talking a little bit about a heart healthy diet. So a lot of these dietary recommendations are very similar to what is recommended for general people. So having an emphasis on including a variety of fruits and vegetables, so having your 5 servings a day, trying to use whole grains whenever you can instead of refined grains, using low-fat dairy products, skinless poultry and fish, nuts and legumes, so those are beans, and then non-tropical vegetable oils, which basically just means like not things like coconut oil, but things like regular canola oil or vegetable oil. The American Heart Association, also recommends limiting saturated fat, trans fat, cholesterol, sodium or salt, red meat, again, all these things in moderation, and then sweets and sugar sweetened beverages when you can. The one thing that is kind of particular for people with heart failure has to do with salt intake. So sodium and salt are the exact same thing. The words mean the same, but talking about this like low salt diet. So in general, they recommend in heart failure not to have more than 2,300 milligrams of sodium per day. Sodium or salt is most commonly found in like the largest amounts in the American diet in processed foods. So whether that be frozen meals, snack foods, pickled foods, soups, lunch meat, cheese, and condiments, restaurant prepared foods, just because we don't know how much exactly someone may be putting salt into those things, or salt like from the salt shaker at the table. So one of the best things you can do to kind of keep track of the salt in your diet is to learn how to read a food label. So I have an example here on the right-hand side. I know everybody's seen a nutrition facts label on something because it's on everything at this point. But if you look kind of in the top portion, there is the piece that says sodium, and it'll tell you exactly how much is in it. And so you can kind of keep track by looking at the food labels, keeping in mind that that's for what the serving size that they've determined. So if you have more or less than that, you're not necessarily going to 100% get the amount of sodium that's on the label. So just keep that in mind as well. But with the other thing that you can do as well is to try to use more fresh foods and do more cooking at home, because those things you will always use, because a lot of your processed foods have salt in it as a preservative because it helps keep the food good and stable. But when we prepare things at home, since we're going to eat them right away, we don't necessarily need to add the amount of salt that is added to a lot of processed foods. So I have an example on the next slide of a cookbook, which I sent to Karen. Hopefully she was able to send to you guys as well. This is from the American Association for Heart Failure Nurses. That they've created this whole cookbook of recipes that are all low in sodium, that are a lot of home cooking, honestly, but a lot of, I mean, pretty normal recipes, like how to make like potato chips that have no salt but still taste good. So it recommends like different spices to put in them, or how to make like hamburgers, different things like that, that are things that aren't totally out of left field to eat, but contain less salt than normal. But again, cooking for yourself and cooking at home is really a great first step, because a lot of the time when we go out to restaurants or we buy packaged and prepared foods, we aren't necessarily always aware of how much salt is in them. So when you're at home and cooking for yourself, you can actually control how much is going in. So if you do have the chance to look through that cookbook, they did put together something really nice. So the next piece here is talking a little bit about stress management. So the American Heart Association recommends spending about 15 to 20 minutes every day dedicated to stress management. And so that means a different thing for every single person. The most important thing in this category is just to find an activity that you enjoy, and something that helps you get your stress levels down. Many people enjoy yoga or meditation. Those are great options. If you find yourself getting angry, it can be helpful in reducing your stress to try to count to 10 before you respond, rather than just saying whatever's on your mind. That can help reduce the stressful response in a stressful situation. And then a really important part of stress management as well is making sure that you're getting enough rest. So adults, we should be getting ideally 7 to 9 hours of sleep per night. I know for different people that looks different, but making sure that you're giving your body time to rest and relax and take time as much as possible, and using those just 15 to 20 minutes to find some way to decompress, whether that is, going on a walk around your neighborhood, or yoga, reading a book, talking to friends and family, whatever it is that helps you de-stress, that is what you want to try to do. There are a couple other guidelines then that they recommend. So it's important that you're kind of keeping track of your health. There is this app. So if you do have a smartphone and are kind of interested in technology and ways to help technology manage your heart failure, the American Heart Association has this app called the Heart Failure Helper. It is an app that you can put in your symptoms, that you can put in measured blood pressure, whether you've taken your medications that day, all into the app. And then it'll give you like a couple questions of like a survey of like, how are your symptoms today? Did you take your medicine today? Did you measure your blood pressure? How's nutrition going for you? So it can kind of do a lot of these things that I've been talking about for the last few minutes in the app form, and it'll help you keep track of those things. So it is a really good resource. It is free. I looked into it. It's available on both Android and the iPhone. So it has both options no matter what you got. It's also important that you stay up to date on vaccinations. So particularly for people with heart failure, the flu and pneumonia can be greater risks for people who may not have heart failure. So talking to your doctor about when it might be appropriate to get those vaccinations, or if they have them available, just because having that protection and prevention can really help prevent a lot of symptoms from occurring for you. It's also important to seek support from others. So whoever you have in your community dealing with this, we've just talked about a lot of things that maybe would be lifestyle changes that could be really difficult to make, depending on what you're used to. So it's really important that you seek support from others say in a cardiac support group, or you just know other people like in your family or community or those who you know would be able to kind of support you in these things and maybe making these changes or keeping these healthy habits and encouragement, because it's always important to have that. And finally, one note here, as we were dealing with 80-degree heat today in April, I'm not even sure how, is that it's really important. I think we talked about this a little bit last month, is to avoid heat extremes and dress in appropriate clothing. So a lot of times this can mean layers, because when you're really hot or really cold, that can also put increased stress and workload on the heart. So it's important, especially as we head into the summer months, that if you see that they've put out, a heat warning for the day between certain hours, that staying inside and staying in air conditioning might be the most healthy thing for you to do at that time. And if you have to be out, make sure that you're, drinking the amount of fluids that are appropriate, staying hydrated, and, dressing in light layers as you are going out and about, because being in the heat can definitely put some extra stress on your heart. There's another resource here that the American Heart Association had that I thought was great in terms of advocating for yourself. I also sent this to Karen, so hopefully you guys will have this as well. But this is just a resource that the American Heart Association has made for people with heart failure to bring to their doctor's appointments with them. And so there's a lot of questions that you can kind of work through with your doctor. So this might be helpful to share whether you've, had heart failure for a long time, or if it's something that someone or um, even yourself has newly been diagnosed with, can kind of help you in understanding, because it kind of takes you through understanding your heart failure, any lifestyle changes that they would recommend, identifying the needs that you would have, particularly related to this condition, and then even talking more about treatment. So I thought this resource was great because it kind of helps broaden the questions that you may ask your doctor. And I know every time we all go to the doctor and it's this short, like 10-15 minute visit, and you feel like sometimes you don't have all the questions or you don't know what to ask, especially if it's a new diagnosis or something that has changed in the treatment plan. And, there's all this emotional stuff tied up into it as well when our condition changes. And so having these questions I thought was really helpful in terms of helping you to know what to discuss and what sort of questions that you might be wondering, and also giving you a place to write it down and take notes, because it can be important too that you can kind of look back on that and say, okay, you know, I want to have this discussion. And then there's also this part here for treatment goals. So whatever your goals are for treatment this time. So whether it's you've been feeling really short of breath while walking and you want to be able to feel less short of breath while doing activity, like that would be a great goal. But that's going to depend for every single person. So that can be something that you can even show your provider and say, you know what, this is what I really want to work on. What's the best treatment plan to help me get there? There is also a second page to this talking about symptoms. This one is talking about how you should be tracking and reporting symptoms. What sort of things would you want me to notify you about? So that can even be more particularly related to your condition than the things that I've already talked about. And then finally, there's a section about medication. So if you are supposed to take medication, what those medications are, what should the medications do, and then what'll happen if I don't take them. I think is all really important things to understand. So that can kind of help guide a little bit of that conversation about when a medication is started or stopped, what sort of things that you should expect. So kind of giving more tools. And then finally on this tool, there is the last piece, which is just talking about learning to recognize and manage symptoms of heart failure. We're going to talk about that more in another second, but I just thought that was a great part of this tool that you can kind of look at and see, okay, these are the things that, maybe those are some of the things that you would want me to notify you about if this is happening. So learning to recognize and manage them symptoms are really important. The last piece of this is just talking about when to seek medical attention. And if you were here last month, then you probably heard a little bit about this already. But going from the tool that the American Heart Association links to that form that I just shared, we'll just talk about things that you want to pay attention to. So kind of like things that you might want to check in with your doctor or your healthcare team about would be a continuous dry hacking cough, worsening shortness of breath with activity, increased swelling of your legs, ankles, and feet, a sudden weight gain of more than 2 to 3 pounds in 24 hours or 5 pounds in a week, discomfort or swelling in the abdomen, or if you have trouble sleeping or waking up like short of breath. So that'd be a great time to, call the doctor's office, maybe schedule an appointment. They may have to change your medications or change some of the treatment plan, but those would definitely be things you would want to let your provider know about. The things that are down here in this red box are more warning signs that you would need to be seen right away. So if you're frequently having a dry hacking cough, it just kind of won't go away at all. If you feel short of breath, even while at rest, if you've increased discomfort or swelling in the lower body, so not necessarily just up to the legs, ankles, and feet, but if you're noticing it up higher, especially like to the hips, that's definitely something they would want to know about. If you have a sudden weight gain of more than 2 to 3 pounds or 5 pounds in a week, neuroworsening dizziness, confusion, sadness, or depression, a loss of appetite, or if you've increased trouble sleeping and can't lie flat at all. I'll see a lot of patients that like they've only been able to sleep in their chair or like the recliner for the past week. That would be something that you would definitely want to let your doctor know about if the only place that you can find that you can actually fall asleep is in your chair. Because that would be an indication that your body's holding on to some more fluid, and that you would need to be evaluated right away. So those are all things that you would want to either call your physician or consider heading into the hospital or calling 911, because those things are all warning signs that, something acute is worse with the heart failure, and that you want to make sure that you get to a doctor or the medical team so they can evaluate you and see you right away and see what might need to be changed so things don't get worse. So it's important that you recognize those things. That way you can kind of advocate for yourself and recognize, this wasn't happening yesterday or the day before when you do come in to see the medical team. That is all that I've got. I'm going to open it up if anybody has any questions on the topic.
I have some questions, Maddie. So once you have heart failure, can you become well again? Or is this how it's going to be for the rest of your life?
Yeah, that's a great question. So that depends a lot on the cause of the heart failure.
Mhm.
So there are a couple cases that I can think of off the top of my head that are kind of these like, I don't want to call it like temporary heart failure, but it kind of is. So if someone has like a big heart attack and their heart function is decreased right after the heart attack, it could be possible that their heart function is regained after a certain period of time after the heart is no longer stunned, and things can kind of go back to normal. Other things like viral infections causing something called like myocarditis, causing like a temporary heart failure, can get better once the infection and the virus has resolved. But for many cases of heart failure, it is kind of like a chronic condition that people will deal with for a long period of time. And so kind of this like question of like wellness versus sickness is more like on a fluid scale. So people can live very successfully with heart failure. They can live at home, they can enjoy a lot of activities. But a lot of time heart failure is a chronic condition. So it is something that people have to be mindful of over a period of time. But that's not to say that they can't, follow a good treatment regimen, make the lifestyle changes that they need to, like take their medication as they need to, see their healthcare provider, and feel pretty good. Mm-hmm. So does that answer the question?
Yeah. Yeah, it sure does.
My dad has chronic heart failure.
Mm-hmm.
But, he has managed. He has what's called a biventricular ICD, which I'm sure you've seen a few of those. And he has had heart failure, I'm going to say at least 10 years now. And he's going to be 88 in June, and he seems to be doing well. He is fastidious about his medication, and he does watch what he eats and drinks. So if my dad can do it, anybody can.
That's great. I'm glad he's doing so well. That's great to hear.
Yes, for me and my sister both. It's very,
yeah.
Anybody else have any other questions? Brian?
About heart failure in children. Is that common? And are they more likely to, not so much as grow out of it, but manage it better than adults?
Yeah, so that's a great question. My background and experience is not in pediatrics, but I'll tell you what I know.
Okay.
So for children, the biggest thing is just the causes are a lot of time very different. So with kids, a lot of time it's due to like a congenital heart problem. So like they're born with some problem. Either the heart didn't form exactly correctly, or some of the blood vessels are not in a spot that they should be, or it's usually like basically like a birth defect is kind of what I'm trying to explain. Whereas in older people, I mean, sometimes these things that they've had since birth can kind of play into the situation. I was even taking care of a patient a couple weeks ago that had a birth defect from birth that really never caused a problem until she developed other symptoms and other problems. But a lot of time they just deal with like a different set of things than older people. Because adults, we deal with like a lot of the heart failure, excepting, the cardiomyopathies that are genetic and people who have like family risk factors and things. With the exception of those, the majority of heart failure that adults develop is from chronic conditions. So like high blood pressure is a big contributor of that. I've had a lot of patients who have been like have abused alcohol, and they have alcoholic heart disease. And so a lot of these things are more from chronic conditions that have kind of built up over time and caused the heart failure. Whereas for children, it's more of like a congenital or birth defect. I don't know necessarily in terms of like, do they grow out of it? Does it get better? Because a lot of those things that are like congenital birth defect things are things that either they need surgery for, or they need to repair it in some sort of way, because a lot of time, for lack of a better word, like things they're not where they're supposed to be. So a lot of time the treatment for kids is just different because it's caused by things not being in the right place. Whereas for adults, it's more of this like progressive loss of function just because of the way that life is played out.
I have another question.
Yeah.
So some of us here have had open heart surgery. So I had mine in my late 40s. And having had an open procedure, does that set us up for a higher likelihood to have heart failure down the road as we age? Is there any correlation?
So with the like open chest, like sternotomy itself, like it should not increase the risk like of having heart failure. It's the cause for what the surgery was for is more. So people who have open heart surgery because of blockages in the arteries around the heart or heart attacks may have some decreased function because of the amount of time that the heart tissue didn't get enough blood or oxygen during the time that they were having the heart attack. But if people have heart surgery for other things, like I'm thinking of like aneurysms and things like that, that's not necessarily like having to do with the heart function. That's more having to do with the blood vessels that are after it.
Yeah.
And generally for people who have those surgeries for aneurysms and things like that, like controlling blood pressure and making sure heart rate is in good spot are really important before and after surgery. And good control of blood pressure and heart rate can decrease the workload of the heart. So it might make heart failure like less likely to happen. But again, the surgery itself, from what I know, and maybe, if Amy knows more, she can chip in, but I don't think that like the exact like open heart surgery, it's more like what was the surgery for?
I understand. Yeah.
And afterwards, yeah. So
Got it.
Yeah, I would say so. Open heart surgery won't cause heart failure in and of itself, but you could be in it beforehand, and the cause of it is because you're not getting enough oxygen. And then if you have bypass surgery to bypass your blocked vessels and you get more oxygen, you could get some of your heart function back, Karen. So so it could help. Or if something bad happens, God forbid, during the surgery, it could leave you with heart failure also. That's why you should only get heart surgery places where they do a lot of it and they do it well. Anyone else? Well, Maddie, thank you kindly. You really have given us some excellent information. We are thrilled to have you. We will ask you to come back at some point.
hopefully, I'd love to.
We don't want to keep taking up all your Sundays, but and let us know how you're doing in your career, because we really would like to keep you close with us. If you want to join us or jump in on any future meetings, you're more than welcome to.
Yeah, I would love that. So thank
Alrighty.
you guys so much.
All right, folks, if that's it, let's everybody get back and let's go watch some USFL football today.